a consultative meeting held at the Kavango West Regional Council, health officials raised concern over malaria cases in the region. In her presentation, Chief Medical Officer Dr. Beata Siteketa reported that between November 2024 and February this year, the region recorded 1,487 malaria cases and 6 death cases. She revealed that Nkurenkuru District recorded the highest number of 1,323 cases, while Ncamagoro District has 164 cases only. Katwitwi E8 Clinic in Nkurenkuru District is topping the number of infections among all clinics in the region. In response, the Health Directorate has distributed 3,000 mosquito nets to the affected communities to help curb the outbreak.
The bar graphs here, they show percentages of the malaria cases by locality, which is week 45, as we mentioned already, is November, up to date where we are. So for Ncamagoro, we had 84% local cases. This slideshow was, the slide was actually inserted just to show that the cases that we are mainly picking up are local, because we had some debates or disagreements that the malaria cases that we are picking up are mainly non-local, which is now the Angolians. But this slide is showing us that most of the cases that are picked up is local. For Ncamagoro, 84% is local, and only 16% is non-local, which is mainly Angolan. And for Nkurenkuru, 71% is local, and 29% is non-local. So as a region, non-local is only standing at 25%, and then the local cases are the ones that are at 75%. I want to pull your attention to the first one, which is Katwitwi E8 Clinic. It recorded 583 cases up to date. The lowest facility that recorded is Ncamagoro Clinic. Maybe they have the advantage of them being inland. But if we look at the facilities that are alongside the river, those are the ones that are topping, like Nkurenkuru Health Center. Pungu Health Center is not at the riverside, but they have a lot of open water. They've got a lot of fresh water ponds surrounding households. The Mbambi Clinic along the river, Tondoro, Rupara, Nkurenkuru along the river, and they are all topping, except the Sikongo Clinic, which is inland. This one was also for the first time this year that it has been recording such high numbers. When some research was done, we noted that it's mainly imported cases. So somebody is bitten here, they can visit Nkurenkuru, they take along the mosquito. And the other mosquito, they reproduce on the other side, and then we started picking up cases at Sikongo.
In the meeting, Chairperson of Kavango West Region, Joseph Sikongo, expressed dissatisfaction with the health professionals, criticizing them of delays in handling emergencies. Sikongo cited a recent incident at Mburu-Uru Clinic where a patient was allegedly denied transport to Nankudu District Hospital. Sikongo further accused young nurses of not wanting to handle patients with care.
I came to Mburu-Uru Clinic. I found a very serious patient that I was afraid to load him in my private car because I'm not a nurse. They called, the nurse at Mburu-Uru called Nankudu, and the Nankudu told them they don't have transport. The the patient is about to die, and I called the director. The director called Nankudu. Nankudu responded. None of them was calling them. You see how bad we are cheating our own people. It's very bad. But when she called them, they availed transport. I was standing at the hospital. I said, I don't leave this patient. He must die in my car. But before he dies in my car, health personnel must respond. The car was sent. But if I could not call the director, the car could not go to Nankudu. These are black Namibians that are acting like the colonial system. And you see, this is really nurses that are, I don't know why our youngsters are so special today when they are in uniform. They work like they don't touch dirty people.
Additionally, Sikongo dismissed the Health Directorate's outreach program draft, calling it unrealistic with the situation on the ground.
You go and you see at how they draw their programs, outreach programs. It's very funny. Tondoro, for instance, that are supposed to stretch up to even Kalikao, they are no longer going to Kalikao. But an individual who is in charge to draw outreach program gave Tondoro only 7 villages to attend. Tondoro, when it comes to transport management, they are very, very perfect. You know, under Catholic, because it is still white that are controlling. But when it comes to the one who draw the program, even Nankudu itself have got many outreach programs. How do you draw a program while you know you don't have transport, but you give yourself so many villages, but the other hospital have to go and attend your line of command, but when they finish, they must give you a report so that you write the report in your in your system as if you were the one who attended. What witchcraft is that one? And I told the staff, this is wrong. If you don't have transport, you even need to have 2 villages, not because Nkurenkuru is a big district, and then you have big catchment area if you don't have transport. You cannot lie yourself. This is the mistake, some of the mistake that we are making. And when they call Tondoro, but if that village is for Nankudu, Tondoro will not go. They will say, it's not our area, that is the area of Nankudu. What type of health system do we have? Why do we limit ourselves? Why do we put boundaries? I think, Comrade Director, I thank you for rescuing that life. If you could not act, we could lose that life just because of our dealings, our human dealings.
Victory Simon, MICT-Kavango West. Nkurenkuru.